Hey y'all. So, I have no idea what I'm going to be talking about in this video. I've had some things going on here recently and I just want to talk about them. So, this doesn't really have much to do with my pre-op VSG journey, really. It kind of is a part of it, but it's mainly just going to be me kind of just talking about some stuff that's been happening to me recently. So if you're not interested in that, I completely understand, and go ahead and feel free to click off. If you are interested in that, thank you, and thanks for listening. So, as you know, well, as most of you probably know, if you don't, there's a lot of things that you have to go through the VSG process. You have to get clearance. Depending on your surgeon, they're going to request you to get different things done. Your insurance company is going to request you to get different things done. I look like a hot mess. I don't even care. So there's just different things that you have to go through. I went through a whole cardiologist that I had to get clearance for. I'm gonna have to get clearance for my primary care physician, which I haven't done yet, but I'll have to get clearance from them. One of the things that my primary care physician wanted me to do is get my female stuff up to date. So that's kind of what has led me here, is I've been following up with my female doctor, OBGYN, doing the typical female stuff. I'm not going to go into detail about that. I'm pretty sure you know what that entails. But one of the things that she asked me when I was there, she asked me if I had any concerns. And for the most part, I really didn't. I just jokingly said something, and this is super embarrassing, and it's something that I don't really talk about to anybody. I mean, my husband kind of knows because he's my husband, but I don't really talk to a lot of people about it. But anyways, my doctor asked me if I had any concerns. I'm like, no, not really, except for the fact that I grow hair like a man, which is true. I hate it. Like, I grow hair on facial hair that shouldn't be there. I grow on my abdomen, like what I call a happy trail, like on a male. Like, I deal with that as well. Like, for like many years I've been dealing with hair growth, and it's just like progressively gotten worse over the years. So she was like, oh, okay, well, we can go ahead and test your testosterone and, see if you have some elevated levels and just kind of go from there. And I'm like, oh, well, I just had my lab work done with my PCP. Wouldn't they have checked that? And then she's like, no, typically they don't check hormones. It's not like a part of the usual routine labs that they do with your primary care physician. So I was like, okay, I mean, can't hurt. So she ran my labs. Little background for me, I've had a lot of medical issues when it comes to like the female anatomy for a long time. For about 4 years ago, I was having, probably started about 5 years ago, I was having a lot of pain. This might be TMI, but this is what it is. I was having pain like when I was going to the bathroom. I was having pain in my ovaries. I was having pain during intercourse. I was just having a lot of pain all the time. At one point in time, I went to the ER because at that time my method of birth control was an IUD, so I thought maybe like my IUD was like misplaced or something like that. So I was just having a lot of pain. Long story short, after testing like different tests, blood tests, sonograms, different kind of things, they ended up telling me that it looked like I had endometriosis, and that if I wanted to have any more kids, that I needed to have them now. Because the chances, as time goes on, the chances of me being able to have kids are going to get less and less. So, anyways, again, long story short, kind of like not have a 30-minute video, I ended up having a hysterectomy because we decided that didn't want to be forced into having more kids. Not to say that I was ready to make the decision to say that I never want to have kids. But at that point, the pain was so bad. I had a procedure that kind of helped a little bit, a surgical procedure that helped a little bit, but it didn't completely resolve the issues. Ended up having a partial hysterectomy. So that was about 4 years ago when that happened. Ever since then, everything's been fine. Like, I no longer have periods, which honestly has been amazing, because I used to have really bad periods. So I'm super happy. I'm happy with that. And obviously I can no longer have kids, which I kind of struggle with on and off here and there. But, you know, it's something that I've come to terms with, and I'm okay with. So anyways, kind of some background. So I, of course, wasn't thinking that anything was going to come of these lab tests, because I had kind of already went through all of this. You know, when I found out that I had the endometriosis. So yeah, my labs come back, and they call me and tell me that they want to see me in the office, that there's some abnormalities on my labs, that they want to speak to me. So they asked if I could come in the next day, which was yesterday morning. So I went in to see the doctor yesterday morning, and she basically told me that I have PCOS, polycystic ovarian syndrome. I think it's something that's fairly common I won't say common, but I've seen it, especially in the weight loss community. I've seen it a lot, so I'm assuming most of you probably know what it is, but essentially, and I'm not well versed on it at this point in time either. I just kind of newly started doing my own research, but essentially what it is it makes you, it's like a hormonal thing, like your hormones just aren't right. Like, that's how they found out, because my hormones were really off. My testosterone levels were really high. So it's like a hormonal thing that, you know, has different symptoms. A lot of people that have this will end up with diabetes or high blood pressure, because your body is like resistant to insulin, and weight gain, like obesity, is very common in this disease as well. So she said that, you know, that based on my labs, and we kind of talked more about my history and the issues that I was having, because at the time when I went to go see her, they asked me, when's my last cycle? And I was just like, oh, I don't have a cycle anymore. So that was as far as they went. And we never really kind of got into my history. This was a new OB for me, so we didn't really get too much into my history. So she kind of talked to me more about my history, and about, you know, and it all started coming out about my, you know, I have adult acne, which is another symptom of PCOS. I've always had irregular periods, very, very irregular periods, which is another symptom of PCOS. I've always had cysts on my ovaries, again, another symptom of PCOS. While I don't have diabetes, I've always had weight issues, again, a symptom. So everything just kind of came together, and she's like, yeah, definitely, this is what's going on with you. And I don't know. I don't know how I feel about it. I feel, part of me feels kind of relieved. Kind of like, well, no wonder why I've struggled with my weight my whole life. Not to say that I haven't done things myself to cause me to gain weight. Like, it's not like I have always eaten healthy my entire life, and you know, I was putting on weight and had no idea why. Like, obviously that is not the case. But like, the amount of weight that I put on, how fast I put it on, how difficult it is for me to take it off, like all of this stuff, like my body has literally been fighting me to be fat. Like my whole life, basically since I almost said came into menopause, not menopause, basically since I like started my cycle. You know, ever since I was a teenager, which is when I put on majority of my weight. That's when all of my weight issues started. And I just don't understand, with all of the female issues that I was having. I remember going through all of this and then finding cysts on my ovaries, and then them telling me that, that the cysts were small and that they don't feel like, that is what's causing my pain. But nobody ever checked my testosterone levels. Nobody ever checked my hormone levels. Nobody ever thought that, that this could be an issue with me, with having irregular periods, with having adult onset acne, with having facial hair and all this kind of stuff. Like, it just blows my mind. How am I 32 years old and just now finding out about this? I don't know. Like I said, part of me is like kind of relieved. Like, she put me on medication for my hormones to get my hormones back in balance. She put me on metformin, which is a diabetic medication, which, not because I have diabetes, I don't have diabetes, but it helps my body not be resistant to insulin, which she also said is going to help me be able to be more successful in losing weight, which is all great. I mean, I'm glad and I'm thankful that I'm finding out about this stuff now and finding out what I can do to try to help it, because obviously going through this process, the VSG, the weight loss surgery plus the medication, I feel like is all going to come together, and my whole life I have struggled with my weight. Oh, didn't expect that. I'm not gonna cry. My whole life, I have struggled with my weight. My whole life, I have lost weight and put it on plus some. My whole life, I have felt like I don't belong. Like that nobody sees anything but me and my weight. Whether I had just lost weight and it's about me losing the weight, or about them thinking about like, oh, she'll put it back on, or like whatever. It's just my whole life has been nothing but my weight. That's what I feel like. It's just revolved around my weight. And here I am, somebody's telling me like, hey, like, it's not just you. Like, you have this thing going on inside of you that's been fighting against you your whole life. Like, this might actually be the turning point for me. Like, this might actually be the time. Sorry. This might actually be the time in my life that I get to take this weight off and not put it back on, plus some, plus 20 pounds, 30 pounds. Like, this could change everything. Between getting the weight loss surgery and getting my body to work with me instead of working against me, like, I might actually be able to close this chapter in my life, like, where my life doesn't revolve around my weight. I'm not naive. I know that the process is going to be a long process, and I know that I'm going to have to work for it, and I know all of that stuff. But this could finally be like the end to it all. Like, this is the next chapter. I finally get to close that chapter in my life, and I finally get to move on to the next chapter. So while I'm like, why did nobody find out about this like a long time ago? Frustrated at that fact, I'm so like, I just feel like a weight has been lifted. I feel like things just kind of, I don't know. I feel like things are falling into place. I'm happy. I'm excited. I can't wait to get this process started. I can't wait to get my body working for me instead of against me. I can't wait to get this process started. I really can't. I'm so excited. So while, once again, I find out that I'm have PCOS, like something I never even thought was that I had, I even knew about, or I had heard other people talk about it. I never knew, like, was nothing that ever crossed my mind, like, oh, maybe I have that. No. But now that I know that's what's been going on, and that I know that there's treatment for it and things that can help me, I don't know what to say. I just can't wait. I'm ready to get this process started. I'm ready to go to that next chapter of my life. So yeah, like I said, I really just talking to you guys, just looking for, there's so many people out there. I've seen other people mention these things, and in the weight loss community, who have these same issues and have known about it for years, and have worked against it themselves. So I would love if you guys have if anybody hears this, watches this video, has PCOS, or knows somebody who has PCOS who has had this surgery, if you have any words of wisdom, any comments, any suggestions, anything, I'd love to hear it. That's it. Thank you guys so much for listening. If you made it all the way through my 16.5-minute video, I really appreciate it. I'll be talking to you guys again soon. I really don't have a set schedule for when I'm going to be doing videos, because obviously I'm still in the pre-op process, so as things come up, I just kind of make a video. But I definitely do plan to be more consistent once I actually have my surgery and I can do weekly updates with my weight loss and all that kind of stuff. But for right now, it's just kind of sporadic whenever something happens, or I have some information, or just something I want to share with you guys. Yeah, so be talking to you guys again soon. Bye.